All right, that was just a short little ditty on the song there, and then we're going live. So happy Saturday, everyone, and welcome to the live stream. We had a little bit of a glitch with the broadcasting software, but we're back online. Linda is, I think, in the middle of nowhere, aren't you, Linda? Where are you?
Yeah, I'm off location here. I'm going to be doing ceremony out west of Red Deer, so this is kind of exciting. I hope everybody can hear me all right.
So
The
because she's going to be a little
internet
choppy
signal
and her voice is breaking up a little bit, that's because she's in the middle of nowhere, and well, I don't know about middle of
well,
nowhere, but she's
could be.
off the beaten track, I would say, right?
Yeah, I think we're getting some static electricity from all the cows outside.
Ah, that's what it is. Okay, all right, cool, cool. So today's topic, we're going to be talking about inflammation, and I like the title, inflammation. What was it now? Inflammation in physically and mentally. What do you mean by that?
Yeah, so we often think about inflammation as being a specific location in our body, as opposed to even systemically, like throughout our whole body. And the other aspect of ourselves that can be highly inflamed is our brain, well known as diabetes type 3.
Type 3. Oh, wow. I've
Yes, because this is putting me on the edge of this topic. Why? Because people talk about inflammation as if that's the reason for all their problems. And I'm really getting tired of even listening to other colleagues and experts and professionals referring to it in a way as if that is the evil.
it's
And it
just a
isn't.
it's just a cause or a symptom, isn't it?
Well, yeah, that's the question is, are we going to call it's actually both?
Mm,
So it's a symptom we can describe. The cause, it can cascade if it's not controlled, or the root cause of the inflammation is determined. You're going to cascade into more serious conditions.
right. Okay, that makes sense. That makes sense. That
Yeah. So putting it to, I'm just, you know, today was supposed to put an end to this discussion on how we just leave it as what was the cause of the problem, inflammation, and then we look for anti-inflammatories to help us through that problem. And that is not the way we want to go about fixing it. Mm-hmm.
Right, right. Well, I remember I had, I guess, inflammation. I remember when I was sick, probably about it wasn't last September, but the following September, and my knee puffed right up, and my ankle puffed right up. Obviously, inflammation. So I went to the doctor because I was sicker than a dog, and just thought, okay, we'll better just check this out. And oh, let's get a needle and we'll suck all that fluid out of there. I'm going, no, you're not doing that. So it's like kind of a little, I thought it was a little barbaric in its, let's find out. And she was all giddy about, here we got something we haven't seen in a while, let's check it out. And I went, oh, you're not experimenting on me. So what do you say to stuff like that?
Well, once again, we're looking for the quick fix.
Yeah, yeah.
And the reason why we look for the quick fix is, acute inflammation can be very painful. Let's face it. So a good example of that would be gout.
Mm. So what is gout? I've heard
Sore.
that before, but what is gout?
Gout is an inflammatory response to buildup of uric acid in the blood, and they claim that it crystallizes out into the tissue, and that is those urate crystals are very painful in soft tissue. So they should have been cleared out through the kidney. So obviously the kidney is overwhelmed, and
Mm,
then you have to ask, why is the kidney overwhelmed?
right,
And you keep continuing asking the why question and addressing that.
right.
So You want to have an immediate fix in that situation. And what is a quick solution for any inflammation is drinking enough water.
Oh, okay. That was actually going to
Lots
be
of
my
water.
next. That was going to be my next question: is how do we deal with inflammation? So lots of water.
Yeah, for one thing,
Lots of
besides
water.
finding out what yes, exactly, rehydrating so that these crystalline structures don't have an opportunity to deposit. And it doesn't matter where, it could even be in your eye.
Oh,
So,
wow.
is macular degeneration and cataract formation due to inflammation? Yes, of a sort it is, because when the um, venules of the eye are compromised with inflammation caused by whatever debris is flowing through those vessels, you're going to get a deposit of glycosated particles, for instance, in the eye from elevated blood sugar, which is on account of being an unstable blood sugar or becoming insulin resistant.
Oh, geez.
So they like to say that cataracts are due to exposure to ultraviolet light, which, yes, can be damaging to the eye under large exposure periods, but it's not the only reason why we develop cataracts or macular degeneration. It's actually a lack of good blood flow, bringing in nutrients into the eye and clearing out the debris. And if the
Oh,
debris is causing inflammation on the inside of those venules, um, which the body naturally reacts and goes, gee, I have to protect myself. So it starts to coat arteries and veins with any byproduct the body can produce. It's very smart at correcting and protecting itself. So it will coat those arteries with cholesterol and calcium so it doesn't get or sustain any further damage from what is actually flowing through the blood vessels. So that's the real cause of inflammation, and that's the purpose of today's talk. Because I'm putting this stuff to rest. It's
right.
kind of one of those one of those pet peeves for me.
Yeah, no, that's good because we hear this term inflammation all the time and do this and do that because of inflammation and inflammation's the devil, and I think it's other people's opinions or wrong thoughts. So it's good to have this cleared up. I think I can speak for everybody online here that we sure appreciate getting some clarity on what is inflammation. Now, a question for you: if inflammation is both a symptom and a cause, how do we deal with the two? Do we deal with them differently? Like if it's the symptom, we have to deal with it differently than if it's a cause?
No, they're actually one and the same.
Oh, okay.
So inflammation is what we're seeing, which is, pain, redness, swelling. Those are the typical classic signs of inflammation. Its cause, well, if it's a cause, well, we need to look at, well, why are we becoming inflamed in that area? Is it damage?
Mm-hmm.
Most likely it is on some level, like whether we did it to ourselves, in an activity, a trauma, or is it something that's become the metabolic byproduct of debris in our body? So we look for outside sources that caused it. So they will tell us, oh, don't eat these top 10 foods. I don't know about you, but I think everybody's getting bombarded with don't don't do these things and don't or avoid these foods, and then you should eat more of these other foods to help reduce inflammation. But it actually can be reduced to a much simpler level. And the body, you have to respect the body knows inherently how to best heal itself. So anything that starts to look like an uncomfortable thing within our bodies, we have to ask, well, why is this doing to myself? Why is it doing it to me?
Mm-hmm.
and getting to the root of that. So breaking natural law is what you end up with, is the body looking for homeostasis again, balance. So
Right.
what did you put balance? And this is its reaction. So uh, inflammation is part of the healing process. The body
Hmm.
releases a certain type of cell set that creates the inflammation in the fluid and brings in other cells to help repair the tissue there. So it's actually a positive thing in that situation. So it's natural to see inflammation around a cut, for instance. Your finger gets red.
Yeah.
Mm-hmm.
Yeah. Okay. So
That's the
what should we do with this? So so now that we kind of talked a little bit about that, what do you recommend for us lay people who want to that hear this term inflammation? Should we just be more focused on just overall health and let the body take care of the inflammation, or invoke the inflammation if needed, and just not be so concerned about it? What's your thoughts on that?
Well, I think it's a great sign for you to start to pay attention. If we have inflammation and other symptoms starting to happen, for instance, if you have diabetes, it's a sign of inflammation. If you have a urinary problem, it's a sign of inflammation, but there's bigger things going on in the body that are giving you those endpoint diseases, we can say. So understanding that we need to go back into balance and redistribute what we have put out of balance by focusing on a few main things. So it's really very simple, and most of us know when we're doing it or not doing. And I mean, obvious things like smoking or vaping, for instance, taking extra chemicals into our body that aren't natural,
Mm-hmm.
like unprocessed foods, those are irritants to our natural metabolism and health. It's got to be things that our body recognizes. So if we're really loading up on unprocessed salts and chemicals and preservatives in our food, or overly fried or fake foods, those are irritants that we have to metabolize out of our system. And then we put pressure on our body to perform differently, like the kidney and the liver. And then the gut doesn't know what to do with this stuff. And it just becomes a vicious circle.
Mm.
And lack of exercise, of course, you need exercise to force circulation in the body, so there's more cleansing through the filters, the kidney and the liver. We talked about this before too.
Yeah.
So and the other controllable item that our bodies don't know how to metabolize effectively, particularly if it's in the long run, is alcohol. So that's considered one of these foreign chemicals that can do damage over the long term on our kidneys and our liver.
Right.
Yeah.
Okay.
So it's that those are the sources of inflammation, are, not paying attention to those main areas. So if we want to get inflammation out of our bodies, we must be doing those things and just reviewing, well, where have I gone wrong in any of those categories?
Right. Right. Yeah. Okay. That totally makes sense. That totally makes sense. Um, let's see.
So
Are there?
let's talk about
Oh, go ahead. No, go ahead.
go ahead. Well, I was going to say the other category that we need to understand and appreciate is, are we mentally inflamed? So what do we mean by mentally inflamed? It's our thinking process. We become irritated, anxious, worried, depressed, and those things over a period of time. Many of us have been experiencing a change in our thinking pattern in this last couple of years. So how we reset that approach to thinking, and then that will often impact how well we sleep and rest. And we need good sleep and we need good rest to rejuvenate to detoxify, to metabolize, and get rid of the inflammation.
Right, right. And so, would you say that the inflammation, in our brain is more of a self-inflicted because we're not dealing with issues and stress and all of that sort of stuff, which cascades into the body?
Mostly, they're talking about how we more like the vagus nerve then implements the a sympathetic fight or flight reaction in our system. So to correct and reset the vagus nerve, that's the diaphragmatic breathing, because the diaphragm helps to reset the vagus nerve through long, deep, slow breathing, as I've demonstrated in the past, to help calm the nervous system. Of course, if we want to be worriers and react with anger or emotional indecision, then we create all of this anxiety and sympathetic reaction. And that in itself can produce the neurotransmitters and the hormones and the chemicals in our bodies that create inflammation. So, cortisol has a double edged sword produced by our adrenals, that it acts as a natural anti inflammatory short term, but if it's prolonged stress, it actually can deplete cortisol. You don't have it in reserve for those times when you need it to become sharp, focused, pay attention type um, uh, reaction to a stimulus in our lives. It's not available. And then you start to develop inflammation, allergies, which would normally be taken care of by this cortisol that's supposed to be available through our adrenals. So, adrenal fatigue is not a good thing. We need
It-
to support our adrenal glands with lots of good minerals and rest.
right, right. You said something there that was quite interesting. You said we need to get to a sense of balance. That this, you've got this pet peeve with this inflammation, this term inflammation going around, and and I think that because we listen to all of these different things, and we get, oh, we need to do this, we need to get rid of inflammation, so let's do this, or we need to do this, and we do all of these things, and and correct me if I'm wrong, based on what you said, we're constantly pushing ourselves out of balance because we're listening to all of these other things that are going on. We read an article, we watch a program or whatever, and take this and that'll get rid of the inflammation and that. And so we're constantly, if we're listening to that, we're adding to the problem by not getting ourselves into balance. Is that right?
Yeah, I mean, we all, if we sat down and looked at our lives, we can see that when we are too busy. And, brain inflammation or an inflamed mental uh, indication that we're out of balance there and have high inflammation is we just can't focus. We don't have the concentration. We don't have the patience to read a book cover to cover, because we don't lack the attention ability. So where does that come from? Well, directly through contamination through the blood-brain barrier, you could say, coming from the gut.
Right.
So when you balance what you're eating and how that fluid exchange that bathes your brain, which then affects the neurons in the brain and the neurospasticity and the ability to heal our own brains through sleep and nutrients, is impacted. And we get these inflamed feelings, whether it's mood, anxiety, depression. Those are indicators that we have some brain inflammation going on, not just how we think. So people can have an irritable or inflamed personality as
Mm-hmm.
well. What are those people? They're the ones that are always the negative people. They don't see the good in the world. They aren't grateful for what they have got happening. So you could say those are inflamed individuals, and they have their perspective has been shifted, maybe because of inflammation of the brain.
That's that's so interesting. I actually like now now that you've kind of framed this whole information of the mental inflammation, it makes sense. People who are struggling with different things. I mean, it's a broad brush, but it's still, we've got some inflammation there. Something's not right. So it's an indicator that something's not right, and I really like that. I think that terminology just makes sense to me now that you've framed it that way.
Right, right. So, dealing with infections in our bodies that are very low grade, whether it's irritable bowel or whether it is a form of arthritis, those are low grade infections that our body has to deal with that will create or have an inflammatory response going on there, along with any other autoimmune conditions, including hypothyroidism. That is also a low grade inflammation of sorts because you're not producing the correct hormones to do the jobs in the rest of the body. And then there's a struggle, and then inflammation occurs because the body is working uphill, you could
Mm,
say. So addressing all of these aspects are important to having the body feel in balance. Therefore, it won't create inflammation as an indicator that things aren't right.
right.
Very simple. Need to get into all the, don't eat pork, don't eat these types of baked vegetables, which is another thing I end up telling people. Like, if you're going to have vegetables, try to steam them, because otherwise the sugar content goes up and your body has to deal with more blood sugar issues to deal with.
Right.
So we'll have to do a session on diabetes at some point because blood sugar imbalance, insulin resistance leads to a lot of inflammation, which is why diabetics are very susceptible to their cardiovascular effects and neurological effects of that syndrome. I'm going to call it. I don't call it a disease. It's a
Mm-hmm.
syndrome because there's many different factors involved. But as far as using things like resveratrol or curcumin, and the bioflavonoids are all musts for helping the body feel in balance. You're not using them as anti-inflammatories. Please stop saying that because
Okay.
I'm going to have to come out there and strangle you or strangle people.
Yeah.
They are not anti-inflammatories. You got to start thinking, okay, how are these things helping me?
Right. Right.
What are they really working on?
Yeah. That makes
So
sense. That makes sense. Yeah. It's like
yeah,
the
so
it's
those are
like
my favorite.
yeah, it's like the people out there have coined that. They've used that as their marketing leverage. Oh, this is an anti-inflammatory, and people grab onto it, right? As opposed to the curcumin or whatever is just it's one of the tools in the chest to get balance and get you back to where you need to be. I like what you're saying there about quit using terminology that the media is, because it is the media. Let's be honest, or it's marketing that is putting that out there.
Exactly. Yeah, you might as well get it right. And then you start to understand the deeper way to address your health.
Yeah.
Because otherwise, you're still in that other paradigm of like, um, this to treat that, this, and you're looking for the magic bullet of a single thing instead of looking at the imbalance that's been created on a three-legged or five-legged or however legged number stool.
Hmm. Yeah.
Do
One-legged
you
stool.
understand that? Yeah. Yeah, one leg. That's a pedestal. Yeah, there was something else too. I'm just checking my notes here. Oh, yeah. So I mentioned curcumin, but what's interesting is that there are some genetical types that do not do well with curcumin. And there
Hmm.
are some genetical types that do not do well with milk thistle. So when you're assessing what to use for yourself, these things actually may be damaging to you because you don't need help at that point in your detoxification pathway.
Right.
So you already might have a slow metabolic pathway in that category, and then you make it worse by using a substance that actually enhances that slowness and where you actually need it to be improved.
Got it.
So how do we find that out? That's an interesting thing I'm exploring and beginning to use more in my practice. And that, unfortunately, it's 23andMe. We use the raw data to look at your genotypes, but if you use a practical medical platform to run that raw data through, you'll find out that you have a defect in a particular genome or phenotype, and then it's going to impact how your body processes with particular supplements, herbs, drugs. This is the way of the future. They are going to be looking more and more at how we can be helped by some things and hindered by others.
Right, right.
Yeah.
Yeah, that totally makes sense to me. Dr. Evans, who you know, the dentist, who's not practicing anymore, when he did my thing, he sent off some blood work to check to make sure to find out what glues and different things that they could use when they were replacing my amalgam filling. So it totally makes sense because I've done that. And he got this list back saying you can use this, this, and this, but don't use this, this, and this based on me, right? So that's cool. And so you'll be able to help out with some of this stuff with patients and kind of guiding them of what they should and shouldn't have. I'm assuming that's just part of your process.
Yes, absolutely. And using the dental, what do I call those products in our mouths can set up inflammation if it doesn't best suit you.
Mm-hmm.
So they don't have any options,
Yeah.
unfortunately. So what's the bottom line there is you look after your teeth and your gums.
Yeah.
So
Exactly.
so you don't need these.
Yeah, exactly.
Yeah.
Exactly. Well, we're at the top of the hour. Anything else before we wrap up here, Linda? Anything else you want to bring up?
No, I think we touched on a lot of good things. And if this particular recording doesn't work out, Gary will redo it and maybe snap through some people to ask us some questions.
Yeah, it actually is not too bad.
Sometime.
Yeah, it's been breaking up a little bit, but it's actually been pretty good so far. We'll get people to comment to say, hey, is this what do you think? Is this good enough, or do we need to redo this one at a future date? Anyways, thank you so much, Linda, and
Yes.
have
And I
fun.
actually wanted to do it, Gary. I wanted to do it in the chicken coop, but I was told the Wi-Fi doesn't reach that far.
Well, that's a good thing. I'm glad you did it where you did it. That's a good thing. So everyone, have yourself an awesome rest of your weekend and the rest of your day, and good luck on all of your ventures, and keep safe, and we'll talk to you again soon. Bye for now.